Ask any parent how the school year is going, and odds are they'll mention the fear and hassle around COVID screening and testing. Could rapid or at-home testing make life both safer and easier? With us on that in Halifax, Nova Scotia, Dr. Lisa Barrett, clinician, scientist, and infectious disease physician at Dalhousie University and the Nova Scotia Health Authority. And here in Ontario's capital city, Dr. Isaac Bogoch, infectious diseases physician at the University Health Network and a scientist based out of Toronto General Hospital and the University of Toronto. Hi to you both.
Great to see you again.
Looking forward to this conversation. I don't want to start off by complaining because I think we're very lucky to live in a province where we have access to healthcare. But I think a lot of us who've had the COVID test, the one that they stick up your nose and it feels like it's tickling your brain. It's very uncomfortable. But that test, I guess, would be considered the gold standard in COVID testing. How are take-home rapid tests different from PCR testing? Dr. Barrett?
Well, it actually depends on exactly the format that you're using. There are many tests that are or will be approved in Canada for at-home use. But across all of those is a difference from the nose tickle you were talking about, in that this is a much more shallow or front of the nose type of test. The swab goes in a couple of centimeters into the front of the nose. You swirl it around yourself and not require an additional person. That can happen in individuals who are smaller kids, right on up to very much older folks. And that test then goes into whatever format the downstream part is. But the swabs are all very similar, front of the nose, no brain tickling at
It does feel like it, but Dr. Bogoch, how effective are these rapid tests?
So the short answer is they're very effective. The more nuanced answer is it depends on what question you're trying to ask. Right? The PCR tests are exquisitely sensitive in the sense that they will detect shreds of genetic material that's in the back of your nose. That could include someone who's got a rip-roaring infection. That could include someone who's recovered from a rip-roaring infection and still has genetic shreds in the back of their nose. That could be someone before they start to even develop symptoms and they're starting to build up their viral load. The PCR test is very, very sensitive in picking up genetic material. The rapid tests really address the question, am I contagious to other people right now? Yes or no. So you typically have to have more virus present for those rapid tests to be positive. But you can imagine if you're addressing that question, am I contagious to other people? Not, do I have shreds of genetic material in the back of my nose? You can still make some very, very well-informed decisions based on your behavior. And I'm sure we'll get into that later on in this chat.
There's been a frustration in the province from parents who want access to these rapid tests. And then hearing back from the Chief Medical Officer, Dr. Kieran Moore, about why we might not be using them right now. Are there any benefits to these rapid tests over the PCR tests, Dr. Barrett?
Well, again, I think it really does depend on the question you're trying to ask and what you're trying to do in a given jurisdiction. Here in this province, in Nova Scotia, we have a couple of areas where there is a fair amount of community spread, and I would say most places in the country right now have areas with community spread. And we recognize that when unvaccinated kids go back to school, we have a question. Do these people who have one or two symptoms, not fever or cough, but one or two symptoms, do those kids have COVID or not? Or is this some other of the plethora of other viruses that are around in the community? In other words, should our kids stay home or not? And so for that kind of question, these rapid antigen tests are actually pretty useful in that they get you a quick and easy answer at home. And if they're not the major symptoms, you can actually get your kids to school instead of having to keep them home potentially. Although we are encouraging folks who are sick to stay home. The second question would be in places where you're in a rural area or somewhere without easy access to PCR testing, we want to make sure in Canada, I would expect, that we have some good equity in terms of access to testing. And this would be a good example where rapid antigen tests may also augment that lack of PCR availability in the short run. Quick, easy, fast answers for parents, especially if you repeat the test a couple of days later, which gets over that slight decrease in sensitivity that Dr. Bogoch was mentioning.
Well, earlier this week, Ontario announced that it will offer rapid COVID-19 tests to some schools and childcare settings in what they're calling higher risk areas for unvaccinated and asymptomatic students. Dr. Bogoch, what do you think of this plan?
I think it's fantastic that the province is going to start using rapid testing in a manner that will help create a safer school environment. That is great. When you compare that to not doing rapid testing, it's certainly a major step in the right direction. I think we could debate on the merits of various rapid testing programs and how to use them and where to use them. And of course, a lot of those decisions will depend on resources available and also who you ask. I mean, let's just call it how it is. There's still considerable debate within the medical, scientific, and public health community about the best mechanism and the best way to deploy these rapid tests. But the fact that they're deploying them is already a step in the right direction. And I think if they do this we actually don't have a ton of details as to how they're going to do it. A lot of this is at the discretion of the local medical officer of health. I think we might see some heterogeneity in how these are deployed across the province. Currently, we're hearing whisperings that they're going to use these in more high burden areas. Okay, that's a start. There's other ways of doing this. For example, rapid testing at home before sending kids to school. But of course, you have 2.1 million kids going to school. That's a lot of rapid tests if you have to do that 5 times a week. And we'd run into serious resource issues at this point in time. There's other programs you could do. For example, if there's an outbreak in a school, there's the test to stay approach. Rather than send everybody home, you have people who might have been exposed, enable them to come to school if they have a negative test result. Like, what I'm trying to say is there's multiple ways that you can deploy these rapid tests in a meaningful manner. It's yet to be clear how Ontario will deploy these, and I look forward to them actually using these because it's a lot better than not. If you don't use these tests, you will identify 0 people coming to school with a potential infection. If you do use these tests, you will identify and hopefully alleviate and prevent some people from coming into the school.
I'm glad you said that. I'm glad you said that because there is a little bit of confusion. I'm glad that you said that you don't know how it's going to work out because for a lot of people, we're hearing higher risk areas. And, we know that the province has said, for teachers who who are not vaccinated for whatever reason, that they're going to be tested weekly. We do know that there's kids under 12 are not eligible to be getting vaccinated. So I think there's a little bit of confusion about if you're going to use it in high risk areas, why not just use it everywhere? Dr. Bogoch?
I don't know. I mean, I don't know. If you had the resources available, like if you had an infinite number of tests and the capability to deploy these either at the school or at the home, it'd be great. Imagine if every day someone did a rapid test and said, you know what, my test is negative. I've got a green light. I can go into work or I can go into school because I know my risk today for transmission is exceedingly small. If, almost negative, almost 0. But of course, nothing's 0 or 100%. But I don't think it's reasonable to suggest that we have those resources available to us. And in fact, it's been publicized in many media outlets that there is a shortage of rapid tests and issues with supplying rapid tests because they're in such high demand in many countries around the world. So it would be nice to know what the resources we have available to us now so that we could deploy these rapid tests in a meaningful manner that's basically commensurate with what we have available. And of course, we could always plan for expanding these programs if we have more of these tests available moving forward.
I read that in Ontario, we have access to 4 million rapid tests right now. I could be wrong. But Dr. Barrett, other jurisdictions around the world are using rapid testing in schools, including the UK. And Nova Scotia recently introduced a pilot program. Do we have any evidence for how effective these programs are?
Well, again, it comes back to the question that you're trying to ask. And if your question is, am I going to get and identify folks who don't have any symptoms and prevent them from going to school? There are some programs that are starting to show that, yes, of course, that this does happen and does work. People get into the nitty gritty of questions around tests that we don't need to be asking right now, like, well, what's the false positive, false negative rate? And there is data out there on that. And it says that if you have a reasonable amount of virus around in your community, the false positive rate is exceedingly low, and also that the false negative rate is appropriate, especially for serial testing. So if the question is, are you going to pick up people who otherwise would have been around other unvaccinated people, meaning kids at this point, hopefully, yeah, you do find out that that is the case. And I would assert that it doesn't matter if that's one person or if that is 50 people, because the other part that you're going to manage to do is give people engagement in testing, destigmatize the COVID positivity situation, so to take away some of the stigma of being COVID positive, and engage people in healthy activities like knowing their status until we're further along in this particular pandemic. So other than just finding people, there's a huge amount of evidence and emerging evidence that engagement in this type of testing is an important part of being community associated and community led, which is just as important on the behavior front as anything else.
Dr. Bogoch, Dr. Barrett mentioned false positives, and that was a concern that was raised by Dr. Kieran Moore earlier this week in very low-risk settings, and he said that they can produce false positives. Is this something that we should be worried about, or is this something that maybe is just adding another layer of confusion?
Listen, I think you can't ignore that there will be some false positives, but I think the rate and the impact of these is much lower than what many would suggest. Here's the beautiful part about a rapid test. It's rapid. Like, you can always redo the test, or you can follow up, for example, with a PCR test. I mean, I really think that these concerns are not entirely overblown, but sometimes overblown, because you can create policy to account for this, right? You can teach people, as Dr. Barrett says, teach people how to use these tests and when to use these tests and what to do with a positive or a negative result. Like, these are wonderful opportunities to engage communities in really taking control and empowering people and communities to really ensure that they can be actively a part of creating a safer community environment, a safer school environment. Like, we can do this. We absolutely can. I really think that one of the bigger limitations now might be a supply limitation, and I think supply would limit the scope of a rapid testing program. The other is our creativity, right? Like, in a perfect world with unlimited resources, these could be ubiquitous. I mean, you can imagine a scenario where you have formal programs like what Dr. Barrett discussed in terms of rapid testing in rural underserviced communities, or rapid testing like we're talking about here to get to create safer schools. But you could also take these tests out of the hands of the medical, scientific, and public health world and put them in the community. So have them easily available. And again, teach people how and when to use these and how to interpret positive and negative results. Much like pregnancy tests are widely available. And I'm not saying throwing testing at a problem is a silver bullet and will solve all our issues. Of course it won't. But it certainly is a helpful tool in a toolkit to help create safer indoor spaces. And we certainly can empower people to use these tests in a smart manner. And this will help. Like, this can certainly help. It's not going to solve all our problems, but it can certainly help make this pandemic a lot more bearable and create safer indoor spaces.
Dr. Barrett?
Well, just to follow up on that, again, I think that's an extension. We had a conversation around our group this morning. You know, when do we stop trying to figure out how to comms everything, how to communicate when and if and how, and just turn this into a very much, here's the test, like, folks, this is for you. We talk all the time in medicine and public health about wanting people to own some control over what happens to them and how they do it. This is a perfect example and we've been trying to do that in Nova Scotia. You know, hand this to people, offer a tool, here's something you can do to help. And it's really not an outdated concept with testing. I would say it's coming into its own, particularly with high rates of vaccination. Until we get everyone under 12 vaccinated and we have another season of immunity developed through exposures, we're going to need to keep community virus at a reasonable level without locking down. And being able to detect how much virus is around in our communities is an important thing. And that involves a heck of a lot more asymptomatic, super rapid testing. So really a time to think creatively and come into our own on some of these topics, especially in Canada, where we really talk a lot about this concept of having people have autonomy. Well, now it's time to put our money where our mouth is with respect to public health testing for infectious disease.
And I know for parents who are watching the winter season coming up, kids get sniffles with everything, and you always get nervous about, is this COVID or is this, and I just want to add, like, anyone who has younger kids, kids are very smart. My kids are now, oh, I think I'm not really feeling well. Oh, my throat hurts. Then you have to keep them home because they're manipulating the situation. But that's just an aside. Um,
Maybe
uh,
your kids are.
Very smart. But it would give people, I think, a sense of control and, that peace of mind instead of going to get a test. And if you're missing work to go get your kids tested every day in this winter, it will create a lot of problems. But I wanted to read something from a column that Matt Gurney wrote for TVO.org in response to what Dr. Moore was saying about focusing on high-risk areas. And this is what Matt wrote, and the board is called, "What the hell took so long?" I'm sorry for cursing. But Matt writes, "This makes sense on the face of it, but also gives the government some tiny bit of cover. Well, it doesn't make sense everywhere, but it's worth trying in high-risk areas. Isn't much of a defense for a government that could have mandated what it announced Tuesday many months ago before school had even resumed. But it's marginally better than nothing. So yes, let's celebrate today's news. Tomorrow, we can get back to wondering what the hell took so long." Dr. Bogoch, what's changed since the beginning of the school year until now to bring in rapid testing?
I honestly don't know. I truly don't know. It might be external pressure, but there might be other things that sometimes we're just not privy to that are happening behind the scenes. But yeah, I don't have a good answer to that, unfortunately.
And Dr. Barrett, the Ontario school plan, as we mentioned, is targeting high-risk areas for rapid tests. Do you think they should be widely available for all students?
Again, depends on the question, but I think the answer to the beginning part here is that it makes sense for kids who are not vaccinated to have access. And if you have a supply problem, then you start with something smaller. But I think asking the right question first and answering it, which is probably that, yeah, everyone should have access to this. This virus, just to come back to the virus bit for a moment, it moves incredibly quickly. And if we always use hospitalizations and epidemiology, that's a week behind, to make decisions about where virus is, I mean, the virus laughs at that. It's like, wow, have you folks not learned? So only targeting high-risk areas sets yourself up to develop more high-risk areas. And if you can prevent that by using widespread testing and you have the resources to do it, which I would argue should be available, then that makes the most sense to me, because yesterday's low-risk area is tomorrow's high-risk area.
I wanted to share a tweet here from Harvard epidemiologist Michael Mina, and they wrote, "Symptoms do not mean more virus. Nope. Symptoms can actually even mean less virus sometimes, because symptoms are often the result of the immune response. Often people develop symptoms after peak viral load." So does being symptomatic or asymptomatic matter for how accurate these rapid tests are? Dr. Bogoch.
There's a lot to unpack there. We know that there's a concept of pre-symptomatic transmission, meaning you have a growing amount of virus in your body. You're going to develop symptoms in a day or 2 days, but you've got a lot of virus there. You don't feel unwell just yet. You will soon, and you're transmissible to others. That's a concept that's extremely important, and rapid testing can certainly pick up that virus at some point when you cross a certain threshold. There's people who are completely asymptomatic. They're infected, the virus is in them, they have no symptoms whatsoever from the time they start with the virus to the time they have no virus left in their body. And there's a growing body of evidence suggesting that people in that category aren't as transmissible as others. Now, again, I wouldn't say that's case closed. There's growing evidence suggesting that, but there's still some scientific debate over that. I think the point that Dr. Barrett made earlier was fantastic, in that, these rapid tests in asymptomatic well people can serve a purpose if the goal is to identify people who might have virus in them, especially in the pre-symptomatic phase, and prevent them from going into work or school and infecting others. The other important point, too, is that we know some people have mild symptoms. Sometimes that's referred to as paucisymptomatic. And, when you just do a very cursory history, people say, no, I'm fine. But when you actually drill down, they do have symptoms. They're not at their baseline, and that's called polysymptomatic. And those are people that have symptoms. Like if it's a binary question, are they symptomatic? The answer is yes. It's just that they're mild symptoms. And sometimes those people, unfortunately, artificially get categorized as being asymptomatic, which is not accurate. And those are people who are symptomatic, just mildly symptomatic, and can still transmit the virus if they're infected. So the point is, these rapid tests will detect if the virus is there. Symptoms don't always tell the entire picture. Broad rapid testing would really help. If it's fast, if the resources are there, if it's fast, if it's widely available and you can get an answer, am I contagious to others, yes or no, in real time, that can certainly drive smart behaviors like, should I send my kid to school or should I go to work?
I wanted to read quickly from something from the person the tweet I just read, Harvard's Michael Mina. And this is something they wrote in New York Times on October the 1st. They write, before rapid tests, people had to assume they could be contagious from COVID-19. That's why people isolated themselves and businesses and schools closed. It is why people missed holidays with their families. But by embracing rapid tests alongside vaccination, people can live with the virus. Workplaces can sustainably reopen. Children can stay in school. The United States should use rapid testing as a complement to the vaccine. Our leaders must work quickly to make this a reality. Dr. Barrett, you've mentioned a few times it depends on the question that you're asking, but we do know that we're going to be living with with the virus for some time now. To what extent is rapid testing essential to helping end this pandemic?
So ending is not the way I'd put it, but what I would say is vaccines are a star quarterback. We're not going to get out of this. This team is not going to win until we have vaccines, and we need that star quarterback. Sending the star quarterback out on their own to win a team event is silly. And the tests, these rapid tests to find and dampen down rapid virus movement is really key. And if we use those two tools together, along with some basics like masking, that will get us through far faster without lockdowns. And so, question independent, rapid tests with rapid virus and a star quarterback vaccine is a team that's going to win over the virus.
And Dr. Bogoch, we've got about 30 seconds.
I would just request that we use hockey analogies instead of football ones on this channel.
What about basketball? Anyway.
All right, that too. Yeah, I mean, we're underutilizing these in Canadian settings. We're starting to utilize them more and more. If we use them in a smart manner, I think we can do a lot of good with these. In the example that was given here, you can use these in a quote unquote test to stay approach where you don't all have to go home and isolate for 14 days if you had a possible exposure. A negative test could enable people to stay in class or continue to go to work. There's good data backing this up and growing data backing this up. There's a lot of different ways that rapid tests can be implemented into our day-to-day lives. We're only starting to do this. We're a bit behind the 8 ball here. I hope if we have access to these resources, we deploy them broadly because they can do a lot of good.
Dr. Bogoch, Dr. Barrett, thank you so much for sparing some time for us. And if it hasn't been said, we really do appreciate all the work that you're doing to help guide us in this most unusual time. Thank you so much for your time tonight.
Thank you.
Thank you.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.